And 1, 2, 3, 4.
Greetings, my name is Lukman bin Amran. I'm a 4th-year student majoring in medical physics at USM. And here, I am presenting on diagnosis of tuberculosis meningitis using MRI. Tuberculosis meningitis is another type of tuberculosis where the culprit itself, which is Mycobacterium tuberculosis, infects the lung and it spreads infection towards the meninges, which are the membrane around the brain and spinal cord. This disease is spread by droplets by a cough or sneezes from one person to another. Those who have or had tuberculosis may have the risk of getting it. However, anyone at any age can get infected with it. This disease is also rare because it usually found in children aged around 1 to 5 years old. Few symptoms are known such as fever, chills, mental state changes, and photophobia. But before that, I need to explain how MRI imaging is conducted. The healthcare provider will ask many questions such as patient history with tuberculosis and symptoms that have or had happened in patient. The healthcare provider will undergo multiple examinations to get more evidence, and MRI imaging is one of them. So inside our body, there are water protons spinning at its own axis, creating its own magnetic charge. The MRI machine deploys a strong magnetic field across the patient, causing the water proton to align with the magnetic field. Meanwhile, a short radiofrequency current is pulsed through the patient, which forces the water proton to align away from the magnetic field. After the RF current is turned off, the water proton returns to align with the magnetic field and releases energy. The energy release is detected by MRI sensor as energy wave and converted into electrical signal and displayed as MRI images. This diagnosis is held with the brain scan protocol, a protocol that comprises a group of sequences that give the general overview of the brain. Examples of sequences are T1 weighted, T2 weighted, FLAIR, and DWI. Tuberculosis meningitis brings out different brain complications such as hydrocephalus, ischemic stroke, and tuberculoma. Hydrocephalus is one of brain complications where 85% of its occurrence is present in children. Hydrocephalus is described as a enlarging of fluid inside ventricle due to its excess fluid. A noticeable sign is a rapid increase in the size of a head. MRI findings show big white spots as signs of hydrocephalus. The second complication is ischemic stroke. It happens when the blood in the artery within the brain is blocked by blood clots. MRI finding of tuberculosis meningitis patients with these complications shown as bright areas in the images. The other complication is tuberculomas or tuberculosis granuloma. This is defined as a space-occupying lesion resulted from inflammation by tuberculosis. MRI finding shows tuberculoma are appear as small ring-like structures in images. The first advantage is MRI imaging produces clear and visible images. Thanks to different sequences that are used, the abnormalities inside the patient's brain can be detected precisely. The second advantage is MRI imaging does not require ionizing radiation. It only uses magnetic field when taking images. Therefore, the patient will have zero risk of getting radiation effect while being inside the machine. The third advantage is MRI imaging can be held without having to physically move the patient. Thus, it eases the process of taking multiple images. The first disadvantage is MRI imaging requires a lot of time when taking multiple images. A typical MRI imaging takes about 30 to 90 minutes, which makes the patient feel uncomfortable and can develop claustrophobia. The other disadvantage is MRI imaging is highly expensive. In fact, an article related to the cost of MRI imaging at UKMCMC states that the cost of MRI imaging takes about 1,200 ringgit with contrast. However, the cost of CT scan with contrast is about RM400 ringgit. The last disadvantage is not all patients are appropriate when using this machine. The patient that has ferromagnetic material implant inside body, such as pacemakers, aneurysm clips, ocular and cochlear implants are not suitable because it will interfere with magnetic field. In conclusion, tuberculosis meningitis is not some kind of disease that is taken lightly, and early and meticulous diagnosis of the disease will help accelerating the treatment. Therefore, MRI imaging is important for this diagnosis due to its convenience on brain inspection.